we really are in a phase of kind of rapidly expanding the treatment options for patients. For over 25 years, we only had one therapy, hydroxyurea, to kind of reduce the symptoms of sickle cell disease. Now we're getting smarter drugs that are well tolerated that can actually work at different parts of the red blood cell sickling process to stop sickling before it happens and actually give a red blood cell that has a function that's closer to normal, improving tissue oxygenation and reducing inflammation. So the Voxelotor and the 601 drug is very effective and changing or stabilizing oxygen hemoglobin complex. There are other drugs such as the pyrite kinase activators, which are able to also shift the oxygen dissociation curve towards the left, reducing sickling and also increasing ATP in the cells. Like any chronic disease, we need to kind of move to a combination therapy. And we've already found that with all these drugs in clinical trials, that they complement or work well with hydroxyurea. And so I think we're moving past that thought that sickle cell disease can be controlled with a single drug, and that most patients will probably need a combination of medications to really have relief from their symptoms. There's the other area of where we're actually getting closer to a curative therapy. As you may know, the gene therapy has come a long ways, and sickle cell disease has been a perfect population to understand better the potential of gene thaeraPy. There are companies and investigators that presented the early work in patients with sickle cell disease as well as thalassemia, and the early results are very promising. However, this is still a very experimental therapy that will take some time to be able to be accessible to all patients.